How long do tear trough fillers last? This depends on which filler is used, how much filler is used, and your own body's ability to break down these fillers. Some people, especially if you work out a lot, break down the fillers faster than other people. That is just something that's inherent to you, and that might be something that you might need to get them more frequently. If you use a filler that's softer, which I prefer a softer filler for tear troughs, something like Restylane is actually my go-to, or something even softer like Restylane Silk, those can last anywhere from 6 to 9 months. If you don't put very much in the tear trough, which a lot of times if it's your first time and you just want to be very conservative, you may see that tear trough filler last maybe 6 months or so. Once you know exactly how much tear trough filler you need, this can last up to 9 to 12 months. I have seen it last even longer, and some people, even up to years later, there has been some filler there when they've had surgery down the line. So it's extremely variable how long it lasts in that location. Because it's not a location that you move a lot, I said it can be 9-12 months, it can be even longer. But because I start very conservatively in that area, because the skin is so thin, this may be closer to the 6 to 9 months in the beginning until we know exactly how much to put in for you. Are tear trough fillers painful? Most people say that the tear trough filler is not actually painful. It's more of an anxiety about it being around your eyes and nervous, because especially if you haven't done it before, it feels like pressure, it feels different. But most people say it's not painful. We have a very good numbing cream, and then also the filler has lidocaine in it to numb the area as you go. So most people are pleasantly surprised that it is not painful the way that I thought it would be. What are the risks of tear trough fillers? So you have the same risks of filler here as you do anywhere else, and that would include migration of the filler not lasting very long, the filler lasting too long, and then of course vascular occlusion. This is the one that we worry about the most. The concern around the eye is that the vessels do go to the eye, and so this is a place that you want to have a very experienced injector injecting. There are a number of things that we do to avoid vascular occlusion in this area, meaning go slow, inject small amounts, inject with low pressure, and always pull back on the plunger. But one of the risks that does need to be discussed with anyone who's getting tear trough filler here is things like the vascular occlusion that can cause loss of skin or even vision loss. This is so rare. These are just case reports, and doing the things that we do, this will not happen. However, that's something that does need to be discussed as something that has been reported in the history of tear trough fillers. Do tear trough fillers get rid of bags? Technically, no, they do not change the bags, because bags around your eyes are the fat that surrounds your actual eye that is protection for your eye, and this bulges out underneath the lashes because the septum, or the fibrous band between the lashes and your bone, or the orbital rim, is not as strong as it used to be, and so you're seeing that fat bulge out. What you can do is place filler underneath that bag and around the bag to camouflage that and make a smoother transition between the eyelid and the cheek. And so basically you're just camouflaging it, but it technically doesn't get rid of it. Have questions? I help people like you every day. Email anytime or schedule a consultation at drangela.sturm.com. Thanks for watching.